Hey everybody, welcome to another episode of What the Vet with Joyce and I. Today we have the pleasure of being joined by Muriel Hendricks with Mentor Vet. Today we're going to talk about something I feel has been up until recently very overlooked in the field. It's been more so geared towards human med, not so much towards veterinary medicine, but it is still a very strong component of our field that we need to be aware of. Without further ado, Muriel, it's all yours and we're excited to see what you have for us today.
Hi, everyone. Thank you, Joyce. Thank you, Amber, so much for having me. And Amber, I completely agree with what you had said. Unfortunately, compassion fatigue is only becoming more talked about within veterinary medicine, and it's something that we have experienced for a very long time. For us at Mentor Vet, we've created programming surrounding topics exactly like this: burnout, compassion fatigue, boundary setting, things like conflict management and ethical decision making. All of these topics that we know are happening and we know all of us are experiencing, but there just hasn't been the platform to discuss those in a very direct, very meaningful manner. So that's where Mentor Vet came in. We started 4 years ago. We have two components of all of our programming both veterinarians and technicians and assistants. We have programming that involves an educational component that is self-paced and online. And those usually are about 6 months to a year long, depending on the program that you are picking. Everything is RACE CE approved as well. So all of that educational component, there is some benefit behind that as far as making sure we have some RACE approval behind that educational programming too. And everything is research based. We just aren't pulling these topics out of thin air. We do focus groups, we do needs assessments, we do the research to make sure we're providing the programming that those individuals are needing. On the flip side, we have our National Mentor Mentee matching platform for veterinarians. It's called Mentor Vet Connect. It's free for all AVMA members. And we also have Mentor Vet teams for technicians. So that way we have a national platform, kind of like online dating, where everyone's creating profiles and then mentees are able to search through those profiles, apply some filters, and find a mentor that fits the needs that they are looking for within that relationship. So that's a little bit about Mentor Vet Tech, Mentor Vet Leap, Mentor Vet Lead, and Mentor Vet Lift. We always have scholarships available for a lot of our programming. So whenever we have people interested in joining one of our programs, we always tell them, go to our website first. If you are looking to take care of some of your professional development, apply for a scholarship first. We don't want you to waste your money on something that can possibly be free. So make sure to apply for a scholarship first.
That's awesome. I love that.
That is fantastic. It's something that's been being in the field for so, that's much needed. Like we've not had that kind of support ever. And that is phenomenal.
Yeah. And we know that everyone has a busy schedule. We know that we are already overworked and we're already really struggling most times within our career at some point. So we've really tried to fine tune this programming to make it self-paced. You do it when you've got the extra time, and also it being meaningful. No one's wanting to watch a video that really at the end of the day is just wasting their time. So we wanted to make sure they're quick snippets and it actually can really start some great conversation at the end of the day.
Awesome. That's fantastic.
Yeah, absolutely. So I've prepared a short presentation. I'd love to go over compassion fatigue a little bit deeper. And then by all means, let's have a discussion about this awesome topic.
I'm very passionate about this situation.
Yeah, I was curious to see exactly what your passion was, or tell me further about your want to have a conversation about compassion fatigue.
I think we lost Joyce. Oh, nope, you're going up.
Nope. Haven't lost me yet.
Yeah, having experienced compassion fatigue versus burnout, I'm very passionate about bringing awareness to what could happen, what your symptoms are, how to recognize it, and things like that in our field, because a lot of people are not aware of it. I did, just full disclosure, I was doing some euthanasia training in a shelter that I was in. And I told the staff, I said, listen, I said, I need you to be very aware of what compassion fatigue is, how to recognize it and what to do about it, who to talk to. And one of the technicians the kennel technicians looked at me, she goes, oh, I'm never going to get tired. I'm not going to get fatigued with this. I said, you have no idea what I'm talking about, sweetheart. None. So there's no awareness, especially, I think it's especially an issue in the shelter community. I feel like it is not as widely touched on in your shelter situations with your kennel technicians, your euthanasia technicians, and the things that they experience. I feel like there's a higher degree of compassion fatigue in that aspect of veterinary medicine than there is in, say, our general practices and our specialties. Obviously, emergency and critical care is right there up with the shelters, but I don't think a lot of people understand what those workers go through.
Yeah. No, and then also the stigma behind it, like even bringing it up.
Yeah. I've had a doctor tell me, or a veterinarian, oh, that's not real. That
Yeah.
doesn't. Okay.
Yeah, it's absolutely real. It's absolutely something that research has shown is incredibly affecting our profession. And I love statistics. I'm very research and scientifically minded. So I did bring some statistics today to show that this is something that is affecting us as technicians, as veterinarians, and it's something we need to continue talking about. As we continue to talk about these tough topics, hopefully that can kind of break down that wall, break down that stigma behind these tough conversations.
All right.
Perfect.
Let's do it.
So, me being educationally minded, I always have some learning objectives before I begin any presentation. So, first and foremost, let's define exactly what compassion fatigue is. And then we'll move into more of its prevalence within veterinary medicine itself. After that, we'll describe the causes and symptoms that individuals may experience if they are kind of showing signs of compassion fatigue, and then we'll discuss how to seek help and where to turn to and identify some resources that individuals within veterinary medicine can turn to when they are really feeling the side effects of compassion fatigue. All right, so first, let's start with some definitions. As individuals that are professionals within veterinary medicine, we are very naturally empathetic individuals. That's a major reason why all of us have gotten into veterinary medicine is empathy is strong with us. Empathy is identification with and understanding other individuals' situations, feelings, and motives. High levels of empathy are part of what makes us really good at our jobs. We care, we put ourselves in other people's shoes, we have to understand and identify how patients are feeling and how to help them or how to treat them if we're but this also puts us at a risk for developing compassion fatigue. Our next definition that I'd like to discuss is compassion. Compassion can be defined as the awareness of the suffering of another, but also coupled with a wish to also relieve that suffering that something is experiencing. So compassion adds that desire and wish to relieve the suffering. So, jumping into compassion stress, many of us feel as if we have to be compassionate to all animals and effective at helping them through their suffering. While compassion may make those in vet med very effective at doing our jobs, it can also be stressful. Compassion stress is defined as the demand to be compassionate and effective in helping. It's that pressure of being compassionate to all of our patients and the pressure to also be effective in helping those patients who are suffering. So that ultimately leads to compassion fatigue. Compassion fatigue goes one step further. Essentially, you become exhausted due to that chronic compassion stress, the demands of being empathetic and helping those who are suffering. Compassion fatigue is distinguished from burnout in that it is specifically entails exposure to trauma or secondary traumatic stress. So, first described in human nursing literature in the 1970s, I love going back into history and talking about where the origins of something first started being discussed. Compassion fatigue has also been called the cost of caring. And it's just defined as the inability to experience compassion as a result of repeated calls for that compassion. So rather than being indicative of an individual who is cold or uncaring, compassion fatigue generally results from an individual who experiences a great deal of compassion and caring but lacks support or helpful coping mechanisms and the ability to distance themselves emotionally from that trauma that they are continually experiencing. So compassion fatigue has been documented in the veterinary profession, but its prevalence varies depending on the method of the population studied. So, Amber, in your instance, when you felt like you just experienced a lot of that within shelter medicine, I think that makes complete sense. Probably most likely due to the large amount of euthanasias. Am I correct in that? Or just the suffering you may see animals coming in?
It was the large amounts of euthanasias. It was we had a maximum capacity for care at, say, 140 animals, for
Yeah.
the resources that we had available. And sometimes we had over 200, a population of over 200. We did cruelty investigations and things like that. And that weighed very heavily, like watching what these animals were going through and having that empathy and wanting to help and wanting to save them all, seeing the things that they were going through. So yeah, that's accurate.
Yeah, absolutely. And that's very different than what individuals may experience in clinical practice or maybe some other niche within veterinary medicine. I think you of all individuals probably see a lot more suffering than the typical individual within practice. So I definitely wanted to point out that compassion fatigue and burnout are very different. Compassion fatigue is just basically the cost of curing become incapable of providing more compassion because we have already given too much of ourselves. Burnout is where we're overworked, we're overutilized, we are to the point where we are just struggling to find the joy in any day. So with burnout, we really need to take care of ourselves, take some time off, and generally putting more focus on mental health and well-being is where burnout can be relieved. However, when we talk about compassion fatigue, taking time off or taking a vacation, that is not going to deal with the traumatic long-term stress and trauma that you are experiencing on a long-term basis. So I would say that is the major difference between burnout and compassion fatigue. Burnout, we need to focus more on mental health and well-being and putting boundaries in place and taking some time off as needed to just recover. Recovering from compassion fatigue is basically recovering from trauma, where it's not so easily fixed by medication. Does that make sense?
100%.
Yeah, good. Okay, so I love charts, so I put a chart in this presentation as well. Putting it all together, this is a model that was created by Bigley back in 2001 to show that relationships, kind of in terms of what we discussed so far. First, there's an exposure to that suffering combined with a concern and also combined with our empathy that leads to an empathetic response. These events by themselves allow all of us to be comforting and helpful and compassionate. Repeated empathetic responses can lead to compassion stress. If compassion stress continues to build, this can lead us within the profession to experience compassion fatigue. Other aspects that can contribute to compassion fatigue are prolonged exposure to suffering, especially when you put in too many hours without a break. Sometimes this is unavoidable. We're in veterinary medicine. Hours are unfortunately unavoidable sometimes, but sometimes this is unavoidable during a very busy shift, or if you have many emergencies coming in. But sometimes this is also self-inflicted by skipping lunch, working overtime, saying yes to a lot of things, or not taking our vacation time. Traumatic memories can also contribute to compassion fatigue. Other life demands may cause added stress to your life, contributing to your risk of compassion fatigue as several studies have examined levels of psychological distress within the veterinary profession. Psychological distress includes pretty much any mental health condition that might warrant treatment from a mental health professional, and may include conditions such as depression, anxiety, suicidal thinking, and burnout. And unfortunately, our profession has a high level of neuroticism. Individuals experiencing perfectionism or anxiety, that is us. That is veterinary medicine to a T. For some reason, veterinary medicine attracts a higher level of individuals with neurotic features. So that is just something to kind of keep in the back of our mind as we're discussing this. While the specific results vary depending on the study, the findings generally support that the idea that psychological distress exists, and it's particularly high compared to the general population, especially in early career individuals, early career veterinarians, and also especially within veterinary support staff. The most recent research from especially the Merck well-being studies show that around 10% or 1 in 10 veterinarians experience serious psychological distress, and 16 to 18% of young vets and vet team members, that equates to like 1 in 6, experience serious psychological distress as well. So the numbers definitely show us that we are experiencing a lot of stress. The numbers also show us that we are experiencing psychological distress, and unfortunately, all of these are leading to burnout and compassion fatigue and all the things that really cause a lot of trauma over time within the veterinary medicine profession. So when we talk about compassion fatigue, let's talk about some symptoms that we can probably notice. Please be aware that these symptoms can also very much describe burnout as well. So when we talk about burnout versus compassion fatigue, we can't just look at symptoms. We have to have full conversations about these things to try and figure out exactly what we are experiencing. So symptoms of compassion fatigue include avoidance and or obsession with something, sleep issues, difficulty concentrating, being easily startled, that a part of that traumatic response, feeling agitated or irritable, hypervigilant, feelings of numbness, also feelings of isolation, and just overly emotional, maybe some tearfulness involved on a daily basis. Do you feel like you were experiencing any of those symptoms? You said that you feel like you're experiencing compassion fatigue. So do these symptoms kind of fall in line with what you're experiencing, Amber?
They do. And I'm aware of it because it happened before when I was in the shelter. Like this, I mean, this is literally like looking at a list of, a few years ago.
Sure.
It was very difficult, and I felt myself, I'm usually very happy go lucky, kind of joking kind of a person, and I became like the Hulk. Like I got obsessed with work, but again, I wasn't sleeping. I couldn't form a thought to save my life. Like I was always very hypervigilant, agitate, like my family even, like, what is wrong with you? And I couldn't feel emotion, if that makes sense. Like as much as I tried to, like I just things that I would normally be like, oh, like, okay, what do you want me to do
Yeah.
about it? You know what I mean? Like it was very I was a shell of a human being, if that makes sense.
Yeah. You've given all of your compassion, all of your emotion
Yeah.
into the veterinary world, and yeah, your cup was dry for sure. Next, let's look at ways to reduce that compassion stress. So within the same chart, Charles Figley suggested 2 factors that could reduce compassion stress. The first is compassion satisfaction, which is a sense of fulfillment or gratification from the work that you're doing. This may be a joy from helping the animals that we are working with on a daily basis, bringing them back, maybe using our nursing skills to help them overcome exactly whatever ailment that they were coming in for, maybe satisfying the needs of an owner, perchance.
Mm-hmm.
Taking joy in the small successes of our jobs, which can be really, really hard to do at times. Finding those small wins can offset some of that compassion stress that we may be experiencing as well. Even if we're doing maybe lunch 3 times a week, we don't have to be perfect. We can do lunch 3 times out of the 5 days a week. That's still a small win. Or helping an animal that we've seen a couple of times and we finally have been able to figure out exactly what's been going on and help and treat them appropriately. Finding those small wins is one side that this chart is describing. Detachment is another factor in reducing compassion stress. This means having a life outside of work. So this is where our hobbies come into play, or practicing self-care strategies outside of work so we can manage the compassion stress on the job. So basically, this chart is telling us that we need to start looking at the positivity within the profession that can cause stress, and that's okay. It's okay that we're in a profession that causes stress. We're educating ourselves about that stress, and we know that we are needing to find the positives within our job to overcome that psychological distress that we are experiencing on a daily basis. And then the other flip side of the thing, how are we taking care of ourselves the moment that we walk out of that building? I always like to describe when I've had a really horrible day. I am an elder emo. I am from the 2000s where I loved listening to Good Charlotte and Green Day and Yellow Card. So that is the music. Yes, that is the music that I would blast as loud as I can on the drive home to fill my cup up, to bring me back to who I am, and realize that I can still be myself outside of work by filling my cup in other ways. So, the preventions and treatments of compassion fatigue are similar to those of burnout. Practicing regular self-care is extremely important. This might include improving your physical and emotional health. Whenever we talk about self-care, we've got the big three. We need sleep, we need to eat appropriately, and we need to take care of our physical health. So whenever I talk about my first conversations, maybe with a mentee on how do we take care of ourselves, those are the top three that I stick with: sleep, nutrition, exercise. And then beyond that, we have all sorts of pillars or dimensions of wellness that we can go into further, which is actually what I'll be talking about next. One main difference of compassion fatigue and burnout is that simply changing your work schedule and the amount of time you work typically will be more effective for burnout than compassion fatigue, like I've already mentioned already, since burnout is most likely caused by work overload. By decreasing your workload, you can better combat those symptoms of burnout, but compassion fatigue is the cost of caring. So simply taking a vacation may not improve your symptoms of compassion fatigue. Seeking professional help can be very helpful if you are experiencing more than those mild symptoms of compassion fatigue. Also, even if you are also experiencing those mild symptoms, it will be helpful to talk to a professional at any time, really. When we talk about the dimensions of self-care when considering personal well-being and professional sustainability, we believe it's important to focus on the elimination of burnout or compassion fatigue. Excuse me. Well-being is not merely the absence of mental health conditions, but it's rather a level of overall life satisfaction. And the CDC defines well-being to encompass physical and emotional and psychological health. We could also include that social well-being, or that financial well-being, or that spiritual well-being, and even a general sense of life satisfaction overall, if that makes sense.
Absolutely.
Yeah, depending on our values or our stage of life, maybe the circumstances we're in, our personality, different aspects of well-being may play a greater role in our lives. So it's important to just be aware of those facets of ourselves so that we can be more in tune with ourselves to then feed our mind, our body with what we best benefit from. Going back to the Merck Veterinary Wellbeing Study, well-being for veterinarians on average mirrored that of the general population. So this means that the overall life satisfaction appears to be consistent with that of the general population. But when we move into the veterinary team members, there were higher levels of veterinary team members in just the like getting by category of well-being. So fewer are flourishing within the veterinary team. So we're talking about basically anyone who's not a veterinarian within a clinic. So we really need to watch out for, honestly, I believe based on the Merck Wellbeing Study, veterinary assistants are the ones that are just really struggling right now, making sure that we really focus on all individuals within our practice. Watching out for each other would be, a very beneficial, positive workplace culture to be around. And last but not least, how can we assess ourselves? How can we maybe we all love online quizzes or surveys or filling out things to see where we're at. Generally speaking, one way to evaluate current burnout and compassion fatigue levels is I like suggesting the AVMA well-being assessment. And I know it says for veterinarians, but I am a technician. I have taken this test several times. It assesses your level of burnout and compassion fatigue. And it's helpful to maybe take it like every 12 months just to make sure that you're monitoring yourself, especially if you feel like you're having an issue. It can be very helpful to identify that maybe the severity of the symptom and maybe when it could be a good time to seek professional. So overall, in conclusion, just being aware of when you're experiencing the symptoms of burnout and compassion fatigue can really help you. If you know the signs to look out for and you start noticing those symptoms within yourself, you know it's time to focus on improving your self-care routines. These self-care practices are just absolutely extremely important, not only for yourself overall, but possibly preventing compassion fatigue and burnout. As we know, they're just all so common within the veterinary practice.
Absolutely. That was amazing. Thank you so much.
Yeah, no problem. I hope I was able to kind of cover the who, what, when, where, why.
Yeah, that was very, very, very explanatory. Like it was, I don't think I've ever heard it put better.
No, no, I was gonna say, I was like, as you were going through it, I was like, I am the burnout section
Yeah.
of it all, not the compassion side. And I just wanted to say that I'm actually going to link the AVMA assessment in the description on the YouTube, so then people can
Yeah.
actually go and click on
Yeah,
it.
yeah,
So that will be there. But yeah,
it
no,
did.
I'm the burnout. I'm not the compassion side of, like, as you were going through all the listings and stuff like that, I was like, oh yeah, no. I'm just the average burnout girl.
Yeah, I think because I've kind of been in small animal surgery the entirety of my career, I definitely feel like I've experienced burnout. But now knowing the differences between compassion fatigue and burnout, I know that I am probably more on the burnout side as well when I was kind of at my lowest point within the profession. Sure. I did just want to give a shout out to my coworkers, Addie and Danielle. They took part in creating this presentation, so I wanted to give them credit for that too.
It was a very good presentation, guys. Very good. So I do have a question, and I don't like my questions are, and I don't know if there's answers for them yet.
Sure.
Is there any tools or resources that are coming up or like through the pipeline more? Because, like, yeah, this was like a lot of it was like veterinarian based, like on the studies and stuff like that, like when they're in school? Like, is there like policies? Is there like any more education on it just to like give them more of a heads up? There isn't any on the tech side, so I'm curious if there is on the veterinarian side.
Yeah, so I just want to make sure I'm understanding your question correctly. Is there anything coming up or being talked about, especially within schools, to discuss these topics like burnout and compassion fatigue? Did I understand that correctly?
Yeah, because it was higher in the younger section on it
Absolutely.
versus the older.
Yeah. So I love that you asked this question because I'm currently at the AVMA conference and there was a well-being panel today, and it was discussed like what is happening for the future of mental health and well-being. And for one, there are more companies, there's more organizations noticing that this is an issue and it's being talked about. So first and foremost, the conversations are happening. Thank
Good.
goodness.
Yes.
We also have organizations and companies, corporate companies that are creating research and statistics that back up what I think we've known for a very long time. So having that research under our belts and showing that we're needing to continue discussing this is also huge for just our profession in general. As far as schools, what are schools doing to talk about this? I love hearing that schools are starting to have more well-being and like specifically well-being coordinators, there's staff within their programs to monitor the students' mental health and well-being overall, and they've got the resources and they are educated and empowered to have those conversations with students, not only if they're just struggling in school, but kind of just to prepare them for the stressors that the young professionals are undoubtedly going to experience after graduation. And I think this is where the mentorship conversation really comes into play. I would love to see schools really push students as they are graduating to build the strongest support systems that they can. Because their first year out of school, they're experiencing transitioning from being a student to an adult. They're transitioning to maybe
Yeah.
their own house for the first time, or buying their
Yeah.
first car, or their first big girl or big guy jobs. The transition time in itself is incredibly stressful. So adding a new job, which is inherently stressful in itself, on top of that, making sure we have a support system in place, whether it be family, friends, spiritual leaders, professional help, professional mentors, all of this support system discussion is growing as well. So I love seeing that. I love that schools are noticing this and having individuals on staff, whether it be a social worker or a trained mental health professional or an individual that is able to talk about this, because it's so clinically focused in our classes. I did not talk about conflict management or anything like that while I was in tech school. So knowing that schools are recognizing that and having trained professionals in the schools is hugely helpful.
I like to hear that. I hope that with future generations, future classes, that maybe that they could work in well-being to being some kind of a curriculum requirement. So you talk about, having these resources and these support groups and things like that that they can form, outside of graduation. But how do we set them up to understand how to go through that process, how to utilize those resources, who they can reach out to, that it's okay if you're feeling some kind of way. I would really like to see that built in, like I said, to the curriculum. Like, this is a requirement that you have to go through this so you have a basic understanding of how to navigate these waters.
Percent. And I do want to point out that educators, the teachers, the professors, the instructors, they can play a big part in this as well, modeling good self-care and well-being behavior, and having these conversations to the students, whether it be formal or informal, can play a huge role as well.
Absolutely.
The one thing that makes me the most excited, and I'm going to use quotes about excited, is because like we're actually talking about mental health.
Yes.
Because, for 14 years, 15 years of being in the vet tech, it was always just stomp down those feelings. You're fine. They're there. It took until like I personally had like my own little mental break that I realized you have to talk about it.
Yeah.
Like we have to normalize the conversations of having about compassion fatigue, burnout, how we do it. And like I have no problem going to work and being like, oh, my brain's hard today.
Yeah.
And like there's a lot going up in here. Like it's a little on the negative side. And people can take that and be like, okay, let's talk about it and like actually have that conversation. But you have to also be aware of it. But the fact that it's happening makes me very, very happy.
Yeah,
Yeah.
absolutely. Being in the profession for 15, 16 years now, I remember when I first started, I was thrown to the wolves. Like
Thrown
you
to the
sink or
wolves.
yeah, you sink or swim. And there's no time to be emotional about anything because you're
No.
showing weakness to coworkers where that could be looked down upon, and you're already in
Yep.
a new job to begin with, so you don't want to have that stigma attached to you. And so I'm so glad that it's just more talked about now. That way individuals who are young can find that
Yeah.
support rather than feeling very alone.
Yeah. And I think too that it's important to have your, your hospital leadership, your administration to be aware that this is an issue, and how, if your staff can't recognize it in themselves, how do you recognize it in them? How do you support them with still being able to ensure operations are running appropriately, but make sure that your staff can make it through the day? To have that open door policy, I'm more than happy to talk to, or we can find you the resources, employee assistance programs and things like that, and not have this jam it, pack it down, deal with it on your own time kind of a stigma. Well, we have a business to run. You can't run that business without those employees. And the more that you invest into them, into their mental health, the stronger your business and your team eventually becomes. So I think that's important too, like having leadership that didn't understand mental health, or Joyce took advantage of it. We've been in that same situation. I think that it's important.
Yeah, absolutely. And I think culture has a lot to do with burnout and compassion fatigue. So having that positive culture is incremental in this entire conversation. And a lot of times that does start with management for sure. I'm trying to Google. So I love that you brought up management and how can management start that psychologically safe environment, and how can we make sure that management has the best professional development possible. That way those conversations can be had safely. And I always think about Josh Feisman, who has authored a book. I'm looking at the book right now, and I've read it, so I feel very embarrassed that I don't know the book name right now off the top of my head. It's called Leading to Thrive, and he is just a leading voice in creating that positive workplace culture. So that's something that I recommend. If we have any management or practice management listening, by all means, look up Josh Feisman's Leading to Thrive, which is absolutely chocked full of not only what he's learned over the years, but practical application for positive workplace culture implementation. So shout out to Josh.
Can compassion fatigue lead to any like long-term health issues? Like, has that been researched? I guess is a better way to frame it.
Yeah, that's a good question. I'm not a professional in this conversation. I haven't experienced it myself. So I would say that we can maybe reflect on that question and say, if someone is experiencing a lot of secondhand trauma for an extended period of time, what might that look like long term, and how would that affect someone health? And just from my own personal experience, maybe experiencing a lot of stress all at one time, I know personally I stopped eating. And I know personally, I don't like to work out because I'm so stressed and I can't think about anything else. And I know I do not sleep well at night. So I think we all can probably think those three things are not going to lead to a very healthy life. And not leading a healthy lifestyle can lead to unhealthy, health concerns. So I think one can reflect on that question and maybe assume some things. But unfortunately, me not being a mental health professional, I don't think I'd be the best person to answer that question. But we can definitely reflect on that and probably come to some great questions that we could ask a professional.
I was curious because like we put ourselves under so much stress, like you had said, and I had to learn the hard way that exercise is a good thing.
Yeah.
And it does truly help, even if you just like go for a walk.
Yeah,
for more
absolutely.
than 5 minutes. But like those three pillars that you had talked about, sleep, eating, and exercise, truly, truly, truly make a difference.
And I'm not even talking about a gym membership.
Mm-mm.
We're on a technician salary. I don't think that is unfortunately part of people's budgets every month. So I love
Yeah.
the fact that you mentioned just taking a
Just
10-minute
taking a
walk
walk. Yeah.
can really clear your head, get you into a more positive mindset, and can really be beneficial.
Get those endorphins moving.
Yeah, for sure.
Helps clear your head a little bit.
There was another question that I had written down and I'm trying to find it because I scribbled all throughout as you were doing this. And then because, I make notes at the time and then I don't remember why I made those notes. So then I have to try to backtrack. There's too many lanes going on, basically. You had mentioned like boundaries putting in place.
Mm,
What does that look like for like an average technician going into a workplace that's experiencing the fatigue?
sure.
How do they put in the boundaries? Because
Yeah,
like I never put in boundaries until recently. And we're talking, 16 years of saying yes, 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 never saying no. You know what I mean? Like I
for
didn't know
sure.
what a lunch break was.
Yeah,
No.
boundaries are so hard for us in our profession because we are empathetic. We as nurses are wanting to try and help as many things as possible, and we have a huge amount of guilt placed on our shoulders, not only from ourselves, our inner thoughts, but also maybe from external things as well, our coworkers placing that guilt on us too. So boundaries are really hard for us to put in place within veterinary medicine just because of our inherent personalities. So when I talk about boundaries with my mentees, I talk about starting small. And boundaries, first off, boundaries are actions that we need to put in place for us to act differently. Boundaries are not put in place to make other people act differently. We cannot say, hey, you cannot talk to me about that anymore. That is not a boundary. That's just being, not a
Assertive.
great person to have a conversation with. Boundaries mean if you're going to bring up this conversation with me, I am needing to walk away. That is my action. I'm not making that person act any differently, but that is a boundary. That's how I define a boundary. What am I needing to do differently in situations? So when I talk about boundaries with mentees, start small. Take, every other lunch break and tell your manager this is not something that I can miss anymore. And I plan on taking a lunch break at least twice a week or something like that. So we discuss starting small and getting those small wins in place. Hey guys, I know that we've been staying a lot this week. I'm happy to be a team player. Tomorrow, I'm needing to leave on time no matter what. Just making sure we communicate fully, that we're making sure that we're not making crazy boundaries that we'll never be able to do. And also, those boundaries are actions that we are doing, not making someone else to act differently.
And it's true. My biggest boundary is leaving when my shift ends now.
Yeah.
And it's
Yeah.
actually like it's like a semi funny joke because like they understand it at work. I will literally I'll be like, it's 5 o'clock, gotta go. And the person that relieves me from my position, and she was like, I looked for you and you were gone. And I was like, yeah, it was time to go. My replacement was here, gots to go. And off I went. Unless like
Yeah.
obviously the ground's on fire or whatever, but then like yeah, I'll stay and that's not a problem. I have no problem staying. But like if it's like a normal day and I don't need to, I am gone with
Yeah.
zero guilt.
We work within medicine. It's not going to be black and white every day. When it hits
No.
5 o'clock, we may not be able to leave. That is just that is just what we inherently experience within veterinary medicine. And there are just days we are not going to be leaving on time, but
Yep.
making sure that we can communicate, we can delegate to try our best to leave when we can and leave when we need to. And when we leave when it's appropriate, then we should be leaving.
Yeah.
Yeah, no, I
Yeah.
have a very hard time with that. Very, very hard.
Yes. Yes, you do.
Trying to establish those boundaries without my staff feeling like I am, a horrible person and that I don't care about them because we've experienced a shortage and I've, in the midst of bouncing between two hospitals, I've been trying to cover gaps and I have nothing left. Like I literally have nothing left and I'm sorry, I can't cover for you for the rest of the day because you don't feel, you know what I mean? Like I love you very dearly, but like I have I have no more gas left in the tank. Like no.
Yeah.
So I have to start putting in boundaries and I feel like it may change the stigma and the culture of the workplace if I do that, but I have to do it.
Because it will, like, let's also talk about how it affects your performance and, your relationships with both your, and, your colleagues and your staff and everything like that. Like, it's all just going to go downhill.
Yeah. Yeah.
Yeah, we will not be providing the best medicine or being the best nurses if we cannot be our best selves.
Nope. You cannot care for your patients if you do not care for yourself. I tell my staff that all the time. You are a human being before you are a veterinary technician. You require fuel, whether that fuel is sleep, food, social life, things like the opportunities for financial advancement. You need fuel before you can be an effective nurse.
Yeah, absolutely.
So, yeah. Well, this has been a fantastic conversation. Like, I've very much enjoyed it because like I said, I'm very passionate about it because it's long been something not acknowledged, and I'm so glad that it finally is. And, we had a
Yes.
BM conference a few years ago that was focused a lot on mental health and what's, the loss of life that we've experienced in our field and things like that. And I'm glad that it's unfortunate that it happens, but I'm glad that it's being brought to the forefront, and there is a substantial amount of awareness surrounding it now, that we're not just in veterinary medicine and play with puppies and kitties all day, that we experience like trauma, we experience, overloads of cases and things like that. Like, and Joyce and I had a conversation with an RN, a couple weeks ago, vet tech versus RN. Well, it may not be the same species, it may not be the same things but it's essentially the same, if that makes sense. We have an abundance of caseloads. We have difficult patients. Not only do we have to deal with the patients that can speak to us and tell us what's wrong, we have to deal with the clients, with their mental health. And I had a woman, I don't want to say collapse, but throw herself on the floor in my lobby the other day. And I'm like,
On purpose or for like a health reason?
because the pet was DOA when she came home.
Okay.
And then brought it in. Pet was in rigor, wanted us to confirm passing of said pet. I was not convinced once we confirmed. Then processes go through, and then, she had elected aftercare in terms of she wanted, private cremation, this, that, and the other. Our cremation service is super fast. They are phenomenal. It's like human grade services. They came, they picked up, and they began the process immediately once they arrived back to the facility. Owner shows up, she wants her pet back for taxidermy. We told her what was happening. We confirmed with the crematory that the process was already in play, and she lost her mind and threw herself on the floor in an emotional fit, and it affected my staff for the rest of the day. So I mean, I'm going off on a rabbit here, but like, it's just the things that we have to deal with. It's not puppies and kitties all day. We don't get to have snuggles and hugs and kisses. We get bit, we lose patients, our clients are flying off the rails. I found a white claw, and one of my technicians found a white claw in exam room the other day in the garbage can. I'm like, who comes in the vet's office with a getting white girl? I mean, what, these are just things that I'm glad are at the forefront now being acknowledged.
Yeah, for sure.
Sorry for that.
Absolutely.
No,
and you bring up, I mean, that sounds like an ethical dilemma that you experienced just within this last week, which is an entirely other conversation that we can have. So just all of these things that we experience is just so stressful overall. And this is why we're needing to talk about it, not only between ourselves in the clinic, between coworkers, but also within the profession as a whole.
Absolutely. Fantastic. Do you have any more questions?
Well, do you have any like effective strategies for like the work-life balance and self-care as like an ending note?
Yeah, I can definitely talk on what strategies I have put in place for self-care and well-being. I am a single mom. I am a full-time employee.
That's already hard enough in life, being a single mother.
I volunteer as NAPTA's president-elect, and I also volunteer as a director for AVTE. So I'm not trying to throw a lot of things out here on the table that I'm working with, but I'm just trying to go to show that I have a lot of things that I'm needing to delegate, and I live by block scheduling. I live by calendars. I am thankfully a very organized individual, so that is what has helped me block my self-care and well-being. I go to the gym from 9:15 to 10:30 every Tuesday and Thursday. I'm a CrossFit gal. So that is not something I do not touch on my calendar. That is blocked and it's not moving. So knowing and putting that boundary in place that I will not be moving that gym time is something that I have learned helps me with my self-care, is actually scheduling it. Yeah, for example, if I want to go to the movies with my kids, I make sure that I block that time out Friday night, that I don't schedule anything else, that is time for me and my family. So I live by box scheduling because I have to. And that is something that has really um, helped me with my mental health and well-being. I did also recently take a Facebook break, being a part of a lot of negativity on social media
Yeah.
was affecting my mental health and well-being. So I removed that from my life. I removed the stressor. So I haven't been on Facebook for about a month, and I thought it would be incredibly hard, and it was the best decision I've made. So removing those stressors to focus more on your mental health and well-being can be a great way for you to focus more on too. So I would say those are two big strategies
Hmm.
where I block my mental health and well-being into my schedule so I can focus fully on that in that time frame, and also removing stressors from my life, easy stressors that I can remove.
Right. Yeah. Well, no, thank you, because I am not good about organization. You know,
Sure.
I know in a day what I'm going to do, but like I don't block, and I think I need to adapt to that model. I think that would help ease my
Yeah,
like
yeah.
my load a little bit.
Start small, just block out that 10-minute walk every day and move from there.
Yep. Yeah. Well, thank you so much, Mario. Really appreciate you taking the time to come out, especially since you're at a conference right now. Just thank you for help shedding the light on something that's affecting our workplace every day.
Yeah, no problem. Like I said, I'm an introvert. Any reason to come back and lounge in my room, I'm all for it. So thank you guys for having me. I really appreciate that. And I really hope that individuals look into MentorVet as part of their mental health and well-being strategies.
Yes, absolutely. We're going to go ahead and we're going to post that in our along with the AVMA questionnaire, and we'll post that in our YouTube link to
Yes.
get the word that you guys are there, and hopefully get some more of our veterinary professionals to utilize those resources.
Great.
Well, thank you for taking the time to talk to us today. We really appreciate you, and I very much enjoyed this conversation.
Thanks, guys, for having me. Have a great night.
Thank you. You as well.
Bye.
Bye.